Hello and welcome. My name is Tamie Yost, and I'm here at Restorative Health Care talking with Dr. Heather Wisniewski, chiropractor here at Restorative Health Care. Could you say hi, Dr. Heather?
Hi everyone, how's it going?
Well, I have, seeing as we've talked about it earlier, a question for you.
Absolutely.
What is the most celebrated organ of the season?
The liver.
Oh.
We're at St. Patty's Day here, Tamie.
That's right. We dye the river and the liver green at this time of year.
Sure do.
Now, what are the main functions of the liver? Why do we celebrate the liver at this time of year?
Some of the functions of the liver, which I think people do not understand or realize, is quite extensive. There are to date that they've been able to identify 893 functions that the liver does 24 hours a day. Some of the big ones have to do with metabolism. So a lot of times people associate our intestines and stomach as our digestive organs. Yeah, they pre-break down the food, but the actual digestion and manipulation of the food so our cells can use it all happens in the liver. So protein metabolism happens in the liver. Carbohydrate or sugar metabolism happens in the liver. Fat metabolism happens in the liver. On top of that, it produces the bile salts, which are actually stored in the gallbladder and concentrated, that help emulsify fats so the rest of the body can do its job to make it pre-prepared for the liver. The liver also has hormone functions, produces hormones, as well as has a lot of red blood cell functions and lymphatic functions. So it also drives the whole lymphatic system when we talk about the immune system.
So our liver is very, very important.
Absolutely.
What should we be doing to take good care of our liver?
There are some supplements we can take that are very good for the liver. Milk thistle or silymarin is a very common one that you'll find most of the time, or if you go to the health food store that they'll recommend. But some of the other not well-known ones are inositol, choline, curcumin can help with inflammation, and believe it or not, even cayenne pepper. Garlic helps with cholesterol function, also done by the liver. So there are some extra little things that people may not necessarily associate with liver function.
Now, how do we know if our liver is functioning properly?
You look at the stool. Okay. Watch for color changes in the stool, formation of the stool, whether or not you have diarrhea, whether or not you have constipation. We can also look at your sugar levels going up and down. If you're having hypoglycemic events, your liver is not functioning. You know, a lot of people like to look at hypoglycemia as a pancreatic disorder. It's more of a liver function disorder, especially if you're heading into type 2 diabetes. The other thing that you can look at is how you're feeling emotionally, as well as if you have energy.
Now, you mentioned emotions. Well, what does emotions have to do with our liver?
Well, we're going back to that whole Chinese thing.
Okay, let's go back.
And the Chinese, 15,000 years ago, actually mapped out every organ to an emotion. And not just one emotion, but a grouping of emotions. Our liver is commonly associated with anger, depression, not making sense, irrationality, being kind of reserved on what we're actually feeling, kind of repressing the emotions. Our gallbladder has a lot to do with anger, resentment, and stubbornness. So a lot of times when I'm looking at people who have gallstones, one of the questions that goes through my mind is, what are they angry about? What are they resenting? What are they holding on to and not letting go of? And I've even had with patients that as soon as they let go of some of the big things that have been bothering them, all of a sudden the gallstones surface, become an issue, and we can remedy that.
So the physical and the emotional are all tied together?
Absolutely, the mind-body connection.
So if I need to correct my liver, I should probably look into how I've been feeling recently.
Absolutely.
Emotionally.
Yep.
Okay, well, if anybody out there has any questions on whether or not their emotions are tied into their liver or any of their other organs, they might want to come see you, right, Dr. Heather?
Yep.
And there's something you can help them with?
Yes, one of the techniques I do here is neuro-emotional technique. It's a wonderful technique that looks at that whole mind-body connection, and we can specifically work on things like the liver.
Great. Well, thank you very much, Dr. Heather, and anybody out there who might be interested in the neuro-emotional technique or their liver, please give us a call. Thanks.
Yes, and you can also look at the NET website, which is www.netmindbody.com. That's netmindbody.com.
Thanks.